The glenohumeral joint, also known as the shoulder joint, is the most freely movable joint in the human body. The shoulder is a synovial joint formed by the head of the humerus and the glenoid cavity of the scapula. A synovial joint is diarthrotic, which means that the joint is freely movable. Synovial joints are unique in that they are the only joints with a joint cavity. The joint cavity holds the synovial fluid, which acts as a lubricant to help reduce friction within the joint. The joint cavity is enclosed by a two-layered articular capsule, which is known as the joint capsule. The outer layer of the capsule is a fibrous layer made up of dense, irregular connective tissue, seen here by the white portion of the capsule. The inner layer is composed of loose connective tissue, which makes up the synovial membrane, seen here by the blue portion of the joint capsule. The synovial membrane produces the synovial fluid that fills the cavity. There are 6 types of synovial joints. The shoulder is a ball and socket joint. The ball and socket joint allows the shoulder to move in many directions. The shoulder can flex, extend, rotate, abduct, and adduct. The shoulder is a very unstable joint due to the shallow glenoid cavity. To help with the stability, the glenoid cavity is slightly deepened by a rim of fibrocartilage called the glenoid labrum. The glenoid labrum is attached to the glenoid cavity and articulates with the hyaline cartilage on the head of the humerus. The ligaments that help stabilize the shoulder are the superior coracohumeral ligament and the glenohumeral ligaments. The superior coracohumeral ligament is the strongest part of the joint capsule. The ligament attaches to the posterior portion of the coracoid process and wraps around the superior surface of the humerus to attach to the greater tubercle of the humerus. The ligament helps support the weight of the upper limb. The anterior portion of the capsule thickens slightly into 3 rather weak glenohumeral ligaments. The glenohumeral ligaments attach the glenoid cavity to the head of the humerus. The glenohumeral ligaments are part of the fibrous layer of connective tissue that makes up the outer layer of the capsule. Moving out from the joint capsule, the most superficial aspect of the shoulder joint are the muscles that make up the rotator cuff. The rotator cuff is composed of 4 muscles that help support and stabilize the shoulder. One of the muscles that makes up the rotator cuff is the subscapularis. The subscapularis originates on the subscapular fossa and inserts onto the lesser tubercle of the humerus. The subscapularis medially rotates the humerus and stabilizes the shoulder. Another muscle of the rotator cuff is the supraspinatus. The supraspinatus is located superior to the scapular spine. The muscle originates on the supraspinous fossa of the scapula and inserts onto the greater tubercle of the humerus. The supraspinatus muscle abducts and stabilizes the humerus. A third muscle of the rotator cuff is the infraspinatus. The infraspinatus muscle is located inferior to the scapular spine. The muscle originates from the infraspinous fossa of the scapula and inserts onto the greater tubercle of the humerus. The infraspinatus laterally rotates the humerus. The fourth muscle of the rotator cuff is the teres minor muscle. The teres minor muscle is located inferior to the infraspinatus muscle. The muscle originates from the lateral border of the scapula and inserts onto the greater tubercle of the humerus. The teres minor laterally rotates the humerus. One more muscle tendon that is not part of the rotator cuff but plays an important role in shoulder stabilization is the tendon of the long head of the biceps brachii. The tendon attaches to the superior margin of the glenoid labrum and travels within the joint cavity and runs down in the intertubercular groove of the humerus. The tendon helps secure the humerus against the glenoid cavity to increase stability.